I was trained initially in eye surgery, ophthalmology. When I finished that training, I went into oculofacial plastic surgery, which is basically specializing in plastic, reconstructive, and cosmetic surgery of the face, and in particular the eyelids. One of the major differences between the upper lid and the lower lid is, for the most part, the lower lid doesn't move. When we open and close our eyes, 99% of that is the upper lid. So you not only have the coverage issue, meaning that the eyelid has to cover the eye to protect it, but you've also got a movement issue. Since the purpose of the eyelids is to protect the eye, there are a lot of very gifted and outstanding surgeons who, just by lack of experience, don't feel comfortable doing that. The most frequent thing that I do in both areas for the same reason is cancer surgery. I do about 3 to 4 skin cancer reconstructions every week. It's probably one of the more frequent reconstructive surgeries that I do. These would be people who maybe have a skin cancer in their lower lid or their upper lid. We send them to what's called a Mohs surgeon, who takes the cancer off, and then they come to me for reconstruction. And I've had people have just little nicks out of their lid, and I've had people have their entire eyelid missing. So then it's my job to figure out how to make a new eyelid or put it back together. If somebody has to have a cancer removed from their lid, and it's just a small spot of the lid, just on the surface, literally in some situations we can just let that heal in on its own. You don't even need to repair it. Then if you get into a situation where it's maybe not any wider, but it's all the way through the lid, that lid has to be reconstructed, and in some cases you just have to sew it back up and make sure that everything aligns properly.